Nerve pain in the foot, causes and symptoms. Nerve pain may result from a pinched nerve or a chronic condition such as diabetes. Any foot pain can have a significant impact on daily life, and untreated nerve pain may keep a person from enjoying or accomplishing their regular activities. In this video, learn what nerve pain in the foot feels like, what can cause it. Symptoms. Regardless of the cause of the pain, someone with nerve pain in one or both feet may experience a burning, aching, or tingling sensation. The sensation of an electric shock in the foot or feet. Pain that gets worse during the night or specific activities. Muscle weakness in the area. Also, the same issue that causes nerve pain may alternatively cause numbness. Causes. The following health issues can lead to nerve pain in one or both feet. Baxter's neuropathy. Baxter's neuropathy is a form of nerve entrapment. It results from the compression of the inferior calcaneal nerve, which sits just under the base of the foot's arc. Risk factors include plantar fasciitis, inflammation of the plantar fascia, the part of the feet that connects the heel bone to the toes, obesity, bone spurs, flat feet or fallen arches. Morton's neuroma. Morton's neuroma involves thickened tissues compressing nerves between the toes. A person may experience pain on the bottom of the foot that worsens when walking. Particularly in tight high heels, the pain may fade during rest or after removing the shoes. The pain may be burning, stabbing, or tingling, or it may feel like an electric shock. It may extend to the back of the foot or leg, causing cramping. Some people also experience numbness between their toes. Common causes of Morton's neuroma include wearing narrow shoes, wearing high heels, inflammation of the joints, thickening of foot ligaments, injury to the front of the feet such as from high impact sports or jogging, lipomas, lumps beneath the skin that contain an overgrowth of fat cells. Tarsal tunnel syndrome. Tarsal tunnel syndrome causes pain in the feet and legs due to compression of the posterior tibial nerve, which runs down the back of the lower leg, or the plantar nerves in the feet. Researchers currently do not know how common this condition is, as doctors often underdiagnose it. However, it appears to be more common in females. Symptoms of tarsal tunnel syndrome include sharp shooting pain in the inner ankle and along the foot, numbness on the underside of the foot, pain when flexing and moving the foot, a tingling or burning sensation. The symptoms may worsen at night while walking or standing, or after physical activity. The pain often lessens after resting. Tarsal tunnel syndrome may result from wearing poorly fitting shoes, injuring the feet or legs, developing post-surgical scarring, having varicose veins, having a ganglion cyst, having lipomas. Peripheral neuropathy. Peripheral neuropathy is an umbrella term for numbness, tingling and burning sensations in the toes, feet, fingers, hands, or a combination of these areas. The symptoms may worsen at night. Also, peripheral neuropathy can cause non-specific symptoms that make it difficult to move the feet and do basic activities. Researchers do not fully understand why certain people develop peripheral neuropathy while others do not. However, they have identified conditions that increase the chances of developing peripheral neuropathy. These health issues include infections, a deficiency of a nutrient such as B12, alcohol use disorder, diabetes, certain hereditary conditions such as Charcot-Marie-Tooth disease, which causes a loss of muscle tissue, Guillain-Barré syndrome, a condition that causes rapid muscle weakness. Diabetic neuropathy. Both type 1 and type 2 diabetes can cause nerve pain in the toes and feet. Diabetic neuropathy affects more than 90% of people with diabetes. Typically, the nerve pain first affects the toes and surrounding areas, and it may then slowly spread to the rest of the feet and up the legs. Symptoms of diabetic neuropathy include tingling, burning, sharp or shooting pain in the toes or feet, the sensation of an electric shock in these areas, pain that usually worsens at night, causing sleep disturbances, pain when touching the skin. Researchers remain unsure of the exact causes. Some theories point to changes in the blood vessels, the metabolism, the immune system, or the body's sodium and calcium channels. Several factors increase the chances of people with diabetes developing neuropathy. Advancing age, having diabetes for a longer period, consuming alcohol, using tobacco products. Sciatica. Sciatica happens when something damages or compresses the sciatic nerve, the longest and widest nerve in the body. It extends from the lower back through the buttocks and down the legs, ending just beneath the knee. The most common cause of sciatica is a herniated or bulging disc in the spine. While sciatica tends to affect the back, hips and upper legs first, the pain can spread down the legs into the feet and toes. Symptoms of sciatica include back pain on one side, pain or a burning sensation in the buttocks, leg weakness, pain in the leg and foot. Home care strategies. A person may benefit from using hot or cold packs, resting, taking over-the-counter pain relief medication such as ibuprofen, massaging the feet, wearing a splint for support. Also try to avoid sitting or standing for long periods. Some people find that wearing wide, soft-soled, laced shoes with low heels helps relieve pressure on the feet and nerves. However, for some people with nerve pain, a firm sole may be more beneficial than a soft sole. Diagnosis. First, the doctor takes a history and examines the painful area. They may also request imaging such as an ultrasound or an MRI. If they suspect specific conditions such as peripheral or diabetic neuropathy, the doctor may request participation in a nerve conduction study or blood and other samples for lab test. When to contact a doctor? If foot pain threatens to keep a person from taking part in daily activities, they should let a doctor know. This is especially crucial if an underlying condition such as diabetes may be contributing to the pain and other symptoms.